Thank you to everybody joining us on this virtual press briefing and Facebook Live event. Today we're coming in from Copenhagen from the WHO European Regional Office here in Denmark. We're going to be launching weekly online media briefings from now on, and this is one of a series. Today we're going to be talking about mental and psychological health and well-being during the COVID-19 pandemic in terms of our preparedness and our response. This acknowledges that concerns and uncertainties as well as physical distancing measures are across many of the countries in our region and beyond the European region at this time of crisis can affect people's mental health and well-being, and we'd like to address that in today's discussion. So shortly I'm going to be handing over the floor to the Regional Director, Dr. Hans Kluge, the WHO Regional Director for the European region. We're also going to be joined today by Aisha Malik, who is joining us. She's a technical officer at the Department of Mental Health and Substance Abuse at WHO headquarters. We're also going to be joined by Dr. Dorrit Nitzan, who is our acting Regional Emergencies Director here in the Copenhagen office. So we're going to welcome your questions during this broadcast. We hope that you'll submit them to us, please. We've had some questions in advance, and we're going to use those questions to shape the panel discussion that will follow Dr. Hans Kluge's opening statement. So I hand the floor to you, Hans, to say a few words. Thank you.
Thank you, Rob. Dear friends, unprecedented measures to slow and interrupt transmission of COVID-19 are buying us time and reducing pressure on our health systems, but at a significant social and economic cost. Physical distancing and isolation measures, the closure of schools and workplaces are particularly challenging us as they affect what we love to do, where we want to be, and who we want to be with. It is absolutely natural for each of us to feel stress, anxiety, fear, and loneliness during this time. At WHO, we consider our mental health and psychological well-being as being very important consequences of COVID-19. That's why this topic today will be at the heart of our discussion. But before that, allow me to provide you with a short overview of the current situation on COVID-19 in the WHO European region. Since we last broadcast over a week ago, the number of cases and deaths of COVID-19 in our region have tripled. The rate of increase has been particularly marked in 4 of the 5 countries with the highest number of cases: Spain, France, Germany, and Switzerland. The WHO European region has reported over 220,000 cases and 11,987 deaths associated with COVID-19. This means that globally, roughly 6 out of 10 every cases and 7 out of 10 every deaths are reported from our region. As we speak, the global number of cases in the world has surpassed the 400,000 mark. From available reports, we also know that 1 out of 10 infections are in healthcare workers, and many more are in quarantine, itself affecting the ability of our health services to respond. This is particularly concerning to all of us. As of yesterday, Italy reported 6,200 infected healthcare workers. And we must all take action to protect these courageous individuals as best as we can. They are responding tirelessly to protect and care for you. We can only imagine their increased levels of stress during these times. Yet, they are making great sacrifices for the benefit of the broader community. While the situation remains very serious, we are starting to see some encouraging signs. Italy, which has the highest number of cases in the region, has just seen a slightly lower rate of increase, though it is still too early to say that the pandemic is peaking in that country. Soon we will be able to determine the degree to which the measures put in place in many countries or having an impact. In this situation, we need to remain optimistic and physically and mentally healthy, as this will be key to our psychological resilience in overcoming this challenge united. Each and every one of us is part of a community. It is our human nature to care for one another, as we in turn seek the social and emotional support of others. The disruptive effects of COVID-19 provides us all with an opportunity to check on each other, to call and video chat, to be mindful and sensitive to the unique mental health needs of those we care for. Our anxiety and fears should be acknowledged and not ignored, but better understood and addressed by individuals, communities, and governments. It is essential that we address the public mental health challenges over the coming weeks and months in Europe and beyond, by distributing timely, understandable, and reliable information from the youngest one to the older members of our society, by providing psychological support to frontline workers and bereaving families, by continuing care and treatment of people with cognitive, mental, and psychosocial disabilities, by protecting the human rights, especially those whose rights are often overlooked or violated, including migrants and refugees, prisoners, residents in other closed settings such as mental health and mental hospitals or social care institutions, and people with disabilities. WHO and its partners have prepared a set of COVID-specific materials to inform and guide countries and the public in relation to these levels of mental health and psychosocial support, including briefings and accompanying infographics on social stigma, as well as needs for the general population, health workers, those in long-term care, and others. These materials are now being translated and distributed in many countries of the region. Further materials under development by WHO and its partners include the production of a storybook for 4 to 10-year-olds and versions of WHO tools such as Psychological First Aid and Problem Management Plus that can be delivered remotely via digital platforms. The issue facing each and every one of us is how we manage and react to stressful situations unfolding so rapidly in our lives and communities. Here we can draw on the remarkable powers of strength, resilience, and cooperation that we as humans fortunately possess. Personally, I am trying to stick to what has worked for me in the past when I want to be calm. For example, learning and practicing simple relaxation techniques like breathing exercise, muscle relaxation, mindfulness meditation can all be very helpful in alleviating bodily and mental distress. I also try and acknowledge upsetting thoughts when they occur and discuss them with people around me. They are likely to have them too, and we may be better able to find solutions collectively. Try to stay positive. I have realized that as a husband, father, colleague, and leader, it is now that I most need to display empathy, solidarity, emotional intelligence, and to walk the talk, to leave no one behind. Ultimately, there is only one solution. Act with kindness. Act with love, but with physical distancing. Thank you very much.
Thanks very much, Hans. Thanks for that opening statement. I should have mentioned at the beginning that the WHO materials also that you referred to in your opening statement, we're going to provide some links to those on this channel shortly after we finish the briefing. So you referred, Hans, to the consequences or the mental health outcomes and consequences of the COVID-19 response and of the COVID-19 pandemic. I've got a couple of questions related to that straight up front. One of them is, the first is from Pian Huang, from the NPR network in the USA. And there's also a related one from Martin Bjork from Politiken here in Denmark. And the two questions are related, so I'll read them together. The first question is, COVID-19 has already caused many people to lose their jobs and livelihoods. What can be done now to help improve mental health outcomes later? And the related question from Martin Bjork at Politiken is, what are the long-term consequences of chronic stress that we can expect after a pandemic ultimately ends? And I'm going to ask Aisha Malik at headquarters to immediately come in and answer this question, and then maybe I'll turn the floor again to you, Hans, to support her. Aisha, please, you're on. Are you there?
Yes.
Thanks.
So, yes, thank you for this question. It is indeed a concerning issue. The measures that we have to take to protect each other and society have detrimental consequences for many workers through loss of livelihood. We know that employment itself is a key social determinant for poor mental health, and financial loss is a risk factor for high distress and can be a risk factor for suicide. So mental health, whether it's inside an emergency or outside an emergency, requires different sectors of society to participate in ensuring the well-being of a population. So not only the health sector. And here, as loss of livelihoods becomes a terrible reality or indeed fear for many people, we see an example of where there is an urgent need to protect people who have or who risk losing their livelihoods from the negative mental health consequences. And this protection can be protection from financial loss for all workers, or protection from the deteriorating mental health through ensuring access and continued access to mental health and psychosocial support services. I think for your second question, Rob, there, chronic stress, like that which is created by this emergency, has a debilitating effect on people's mental and physical health. And people with existing mental health or substance use conditions might be prone to experiencing high stress and relapse during this time. And the number of people requiring support is likely to be high, and there will be a need. So mental health services must be strengthened and well coordinated in preparation for meeting this need. Thank you.
Hans, maybe I can ask you to say a few words related to this question.
Yes, I think first and foremost it's important to keep the measures as short as possible, but this is still an unknown on that one. So policymakers have to be aware. We gathered quite some lessons during the financial and economic crisis, and we saw the impact, what happened if mental health services, also social services, were cut. So it's very important that we are at the table when those big governmental issues are being discussed. But meanwhile, we do see good examples. For example, recently announced yesterday by the President of the Russian Federation to protect small businesses, to protect people when they lose their income. So it's a matter of prioritizing the health and well-being of the people above the economic purpose of the governments. And then everyone has ultimately a role to play. It goes down to the leaders, what I call my frontline heroes in the hospitals. And there are many innovations that we see, for example, to put up buddy systems to twin people who are more senior with more junior. So we all have a role to play there. Thank you.
Wonderful. Thanks very much, Hans. And I'm going to keep on with you, if I may, at this point, because we have a second question here. This is from a radio station in the heart of the UK, from Black Country Radio, from Gary Mander, Ian Murray, and Dave Brownhill. And the question reads, the WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. As we see governments around the world imposing strict restrictions on their citizens, what must the world leaders be doing to ensure that these measures do not have a long-lasting negative impact on mental health and social well-being?
Yes. Let's remember first things first. So we know what has to be done. So I think that is what governments are to do. One is really focus still on a containment together with the mitigation, get your hospitals ready, protect the healthcare workers, because that is the absolute priority. Thinking ahead is to be aware that we are facing a new reality. I think that's what we have to come to terms. This is not going to be a sprint. This is going to be a marathon. And there may be, once that the restrictive measures are being gradually released, a little bit of a second pike or a third pike. So we need to prepare the health services for that one with the mental health and financially. It's a whole of government and a whole of society effort. And that's why I'm very pleased that I see in almost all our countries, the response is now being led not only by the Ministry of Health, but with the Ministry of Health at the level of the heads of state.
Wonderful. Thanks very much, Hans. Okay, so a follow-up question from Martin Bjork from Politiken is, are WHO looking into the effects on the Italian general public's mental health and reactions due to the strict curfew imposed by the government? I'm going to send that over to Dr. Dorit Nitzan, if I can. Dorit, please.
Yes, well, we have been, WHO has been on the ground in Italy shortly after the first cases were notified. And we have been working with the high-level mission in Rome and also professional missions and experts that are stationed in Venice, in our Venice office, and helping all the regions. What we are following is that there are lots of activities now being carried and planned to be carried by the Italian authorities. And we are reviewing and watching the review of the availability of mental health mentors, those that are addressing both the needs of the general population and special attention is given to our health workers. Also, the National Board of Psychologists in Italy and multiple NGOs, local NGOs, have agreed to provide their support through dedicated chat lines, online, and free calls, telephone services for the people, for the public. And they have been answering lots of calls. Technical, scientific committees and of the Ministry of Health and the Civil Protection promoted everything they can in the large-scale dialogue to allow the development of a countrywide system to be put in place and to be able to progressively work in the regions and the people at the country and the region. We eventually look at it as a good model for other countries, but also as an internal module within the one that is being built now in Italy for e-services and telecare services. So this is a good example. We are learning from it and hoping to bring it to other countries as well. Over to you.
Dorit, thanks very much for that. And straight on, we go to Maria Oster from Norway. And the question is, lots of stress and anxiety come from the fact that people are not convinced governments handle the outbreaks well. Are governments doing their job well? And I think this is one for you, Hans, if I can ask you to respond. Thank you.
Yes. Linking back shortly to the previous question, a lot of respect for the Italian government, the authorities, both in Rome and at the region level. This was the request of Minister Speranza a few days ago to scale up WHO technical assistance in mental health and digital health, and Italy is helping the other countries so much. So thank you so much, Italy, for that one. On the question from Norway, Rob, this is the question I get most. Are governments doing too few or are governments doing too much? I think the straightforward answer is we know what has to be done. And this needs to be done. Like I was mentioning, to ensure that suspect cases are identified as early as possible, tested, in quarantine, if need be treated with a lot of empathy and dignity. Number one. Number two, prepare the hospitals to what we call flatten the curve, postpone a bit the elective surgery, get the nurses and the anesthesiologists really ready for the COVID-19, to buy some time. And third, really, we need a society, every one of you, mobilized to support this physical distancing measures, get your information from reliable sources. This is number one. Number two, we have to acknowledge that this is a new virus. We are learning every single day. And also WHO is adapting its policies as of we speak, for example, on testing. These are still issues which all evolve. What I'm seeing on a daily basis is ministers, prime ministers calling me from all 53 member states. This morning even, we had the 3 ministers of health of the Baltic countries together to check yesterday, the Minister of Health of the Russian Federation, the Chief Medical Officer, Professor Chris Whitty from the UK, asking the question to me, do you think, Regional Director, we are doing the right thing? So that is what I can tell you with confidence.
Wonderful, thanks, Hans. Next question from Suman Munshi, who's on a diploma of journalism in Ireland. And the question reads, what are the psychological impact of this disease on recovering patients, especially the geriatric group? And I'm going to send that over to Aisha, if I could, please. Aisha.
Thank you. So in previous public health emergencies, people who have recovered can experience a range of psychological distress responses, and that can include things from anxiety, depression, as well as guilt and more. So the other thing is people who have recovered can also be subject to continued stigmatization, which can further worsen their mental health, so stigmatization in the community. So good communication measures or good public communication needs to be in place to help mitigate the stigma of recovered people, and mental health and psychosocial support services in place to ensure the recovery of people who have survived. The second part within that is around older adults, and older adults have been identified along with people with specific underlying health conditions as more vulnerable to COVID-19. And to be told that you are very vulnerable can be extremely frightening and very fear-inducing. So the psychological impact for older adults can include anxiety, feeling stressed, agitated, or angry. And this impact can be particularly difficult for older adults who might have a cognitive decline or a dementia. And some older adults may already be socially isolated and so before this and experiencing loneliness, which in itself can worsen mental health. So, on a note of hope, there are many things that older adults can initiate themselves to protect their mental health in this time, or if needed, be supported by a caregiver or a carer in these. And these can include many of the basic strategies that we're advocating across the population, such as, taking part in some physical activity, keeping to routines or creating new ones, or engaging in activities which give a sense of achievement or a sense of pleasure. And importantly, really maintaining social connections is going to be important for older adults' well-being at this time. And some may be familiar with digital methods, and others may need some support in how to do this. And ultimately, again, this is going to be a repeated message that the mental health and psychosocial support services and other services that are relevant to this population need to continue to be available at this time. Thank you.
Aisha, thanks very much. We are going to keep you on, if we may, just with the next question, which are what are the potential consequences of the collective mental health of a community marred by death and fear to such an extent by an invisible enemy, as some local citizens like to refer to COVID-19?
Aisha.
Thanks. It's a good question. So we are collectively experiencing the stresses associated with this pandemic. And the consequences are, as we've seen in other emergencies, that the burden of mental health and substance use conditions rises and is high. So services need to be prepared and available throughout this response and strengthened in preparation for COVID, after response as well. With death featuring in this pandemic comes the importance of ensuring that loved ones are able to mourn, and that as much as possible that respectful alternatives are provided to ensure that there is some acceptable continuity of burial customs or rituals which are important for any given community. So fear of infection or death can exacerbate stigma and discrimination of people after they've recovered in a community, and this is an unfortunate consequence that we've seen in other emergencies. But just as there are collective consequences which can negatively affect mental health, there can be collective consequences or actions for coping and maintaining hope and solidarity in our communities. And this can include things like supporting neighbours or people who might require assistance, sharing hopeful stories or innovations for how to spend time when in self-isolation, and honouring the health workers and responders at the front lines of COVID-19. So we may be collectively experiencing this stress and this suffering. We can collectively support each other as well. Thank you.
Thanks very much indeed. Thanks, Aisha. A related question to this was to WHO specifically. Is there guidance on dead body management of COVID-19, which is related to that previous question? Maybe Dorrit, you could answer that.
It's on mute.
Dorrit, I think you're on mute.
I'm not. Is it okay now?
Yes, that's better. Thank you.
Okay. There are guidance, general guidance of how to treat and care for dead bodies in general for WHO, but nothing specific for the coronavirus, for this outbreak. So we have to follow the guidelines, the standards, infection prevention and control standards, those that are by the hospitals, the authorities, and follow them strictly. Otherwise, I think I just join Aisha in saying that while we do have those guidelines, the big thing is to let ourselves feel and mourn as a collective group and support each other. Thank you.
Thanks very much, Dorrit. We go over to a question from Moldova now, from Angela Bucesi. How should people be dealing with addiction amidst social distancing? Is tobacco, alcohol consumption increasing? Aisha, can I ask you to respond to that, please?
Thank you. We know that in other times of crisis and other disruptions in health and social support, that people with substance use disorders or addictions face a higher risk of relapse and negative outcomes. This is data that we're collecting at the moment for COVID. High stress is and can be a contributing factor to using substances as a means of coping with difficult emotions. And during the isolation that we're seeing at the moment across societies, is particularly concerning when we think about the association between, say, alcohol and interpersonal violence. So our message is quite clear. Substance use and other addictions, such as gambling and gaming, can be harmful to physical and mental health. And for those with people without addictions, using substances will not help to manage the stress of self-isolation. They can make things worse. So it's important that, again, that the access to services which can provide support for substance use and addictions remains accessible to people during these physical distancing measures. And this might require innovative approaches in how people can continue to access any necessary medications or any necessary care, just like we heard about what's happening in Italy in the innovations there. Thank you.
Great. Thanks very much, Aisha. Next question is in from India. It's for you, Hans, from Anuj Kumar. from Legal Desire Media in India. India is completely locked since yesterday. A lot of fake news regarding fake medicines, treatment, myths about COVID-19 is traveling across social media. Does WHO work with social media platforms like Facebook, WhatsApp and Twitter to tackle such news?
Yes, Facebook and WhatsApp are official partners of the World Health Organization, exactly to provide reliable information to the public. And there is also the website at the WHO Geneva on how to protect yourself, question and answers, and what we call myth busters, which is very, very helpful. Speaking about India, I'm in regular touch with my peer, the regional director, Dr. Poonam Singh, and also the WHO representative, Dr. Hank Bekedam in New Delhi. And I would like to commend the Prime Minister of India for having taken such a bold and decisive measures, which makes us feel very comfortable, and also my full support and sympathy to the people of India in supporting all those measures.
Thanks very much, Hans. Next one from independent journalist Mr. Ramos in Spain. Can you explore more in depth the vulnerabilities young children's mental health is being exposed to now in this COVID crisis? I think I'm going to ask Aisha, if Aisha can respond to that. Let me just repeat that because I didn't read it very well. Can you explore more in depth the vulnerabilities young children's mental health is being exposed to now in this COVID-19 crisis? Aisha.
Thank you. Yes, well, this is indeed an unprecedented time for us all, especially for children who faced an enormous disruption to their lives. Many children have faced big disruptions to their lives. Children are likely to be experiencing worry, anxiety, and fear. And this can include the types of fears that are very similar to what adults or older adults are experiencing. So a fear of dying, a fear of their relatives dying, or a fear of what it means to receive medical treatment. If schools have closed as part of the necessary measures, then children may no longer have that sense of structure and stimulation that's provided by that environment. And now they have less opportunity to be with their friends and get that social support that is so heavily advocated for good mental well-being. And being at home can place some children at increased risk of or increased exposure to child protection incidents or witness to interpersonal violence if their home is not a safe place. So this is something that's very concerning. And though children are indeed very perceptive to change, younger children may struggle with understanding the changes that have taken place and may, as well as older children, express irritability and anger. Through all of these, children may find that they want to be closer to their parents, naturally have more demands on them. And in turn, some parents or caregivers might be under undue pressure themselves. Again, I'd like to answer all these questions with messages of what can be done to address these. And in the case of children, just simple strategies that can help include giving young people the love and attention that they need to resolve their fears right now, and being honest with children, even if they're young, about explaining what's happening and explaining it in a way that they can understand. Children, like I said, are very perceptive and will take how to respond or model how to respond from their carers. So parents need to be supported in managing their own stress as well so that they can be models for their children. Helping children to find ways to express themselves through creative activities, and crucially providing a structure in the day, if that's possible, through establishing routines, it can be really beneficial, particularly if they're not going to school anymore. And ultimately, again, mental health and psychosocial support services need to be in place, and the protection services need to adapt to ensure that the care is available for children and families who need it in this time. And as the regional director mentioned, WHO and interagency partners will be very soon releasing a storybook which addresses 4 to 10-year-olds' fear around COVID-19, and it will come with an accompanying guide for parents, caregivers, and teachers. So we hope this can be a helpful resource at this time. Thank you.
Great. Thank you very much for that very comprehensive response to the Spanish journalist. We have a question next from Albania, and this refers to something that Hans was talking about in his statement about the importance of leaving nobody behind, the importance of reaching out to the most vulnerable in our communities, the most marginalized groups, and to support them. And this comes from Ajola Kunji in Albania, independent journalist. We have a question here that reads, quarantine and self-isolation are particularly tough for refugees and migrants living in overcrowded, poor living conditions. Mental stress adds to physical stress and increased risk of infection transmission. What is WHO doing to help? Dorrit, if I could ask you to respond. Thank you.
Thank you very much. Yes, indeed, this is the area where we really want to leave no one behind or marginalized. This is the time that as a community we need to work. We see it in refugees, in internally displaced people, and also in other groups, people that are, as we discussed before, those that are institutionalized. And if you take the extreme, is prisons, of course. Each of these groups has its own specific issues that needs to be tackled. And here we use different tools that we have already, as in our constitution as WHO, also the international health regulations are looking at human rights. And what we bring to the countries, to the field with us, is our guidance. We have new guidance in different areas. We are working with different UN agencies and other partners on the ground to ensure that these special groups get the care, the preventive care that is so needed. We need to ensure that they can be isolated when they are sick, quarantined, without any discrimination and stigmatization, and doing the right things as we do for the majority. These groups are, for us, are at the center because we are always looking at the most vulnerable and those who are behind and marginalized. We have the tools and we are ready to share. It's on our website. Only this week we started also with disseminating the prisons health, COVID-19. And also we have tools from the UN Secretary General group that is working on it on refugees and IDPs, internally displaced. Over to you.
Great, thanks very much. And related to this, I'm going to turn a question to Hans, also on vulnerable populations, and this relates particularly to the older members of our population and the elderly. And it reads, how can families stay in contact with their older relatives in a nursing home to provide emotional support when access for visitors is restricted? Hans.
This is a huge challenge. In fact, even in the own family, we have examples in Belgium. Key is that the elderly people know that they are thought of, that they are loved, cared about. There is no one size fits all. There are several innovative initiatives ongoing, which now we are bringing into a map, and we hope to make this available in a couple of days on our website. But it also brings back the respect, the huge admiration and respect we need to have for the carers in those nursing homes, for the nurses, the social workers, which are also at risk of infection, but being overwhelmed as well. It takes us a bit back to the past, to traditional means of postcards, of letters, of telephone calls, video chats, if possible, and in very difficult situations, maybe in long-term facilities, options that the next to kin is allowed on compassionate grounds if someone is severely ill to be allowed, but putting the right infection control and prevention measures in place.
That's great. Thanks very much, Hans. And something related to both of your statements and something that Dorrit said a moment ago about avoidance of stigmatization and discrimination. We have a question here from Romania, from Stella Manol. What is WHO's reaction to reports of stigmatization and discrimination based on country of origin of this outbreak? And I'm going to pass that question over to Aisha, please.
Thanks, Rob. So stigma, for people who are not aware, which is related to COVID, is where people are experiencing a sense of shame or disgrace that's been attributed to them due to a perceived association with the virus. And it's very concerning because this can result in discrimination and in violence. So it's important for us all to remember that this is a virus which has affected many people from many countries, and attributing it to a particular geography or ethnicity can contribute to stigma and discrimination for people who are perceived to be part of that attribution. And our choice of words can make a really big difference in changing the tides when it comes to stigma. So we suggest do not attribute it to a particular geography or nationality or ethnicity. Don't stigmatize people who've recovered from the virus. They need your support now more than ever. Solidarity and working together collectively is the way to fight stigma. We have to continue to support each other, share hopeful stories, correct misinformation where we see it, including fighting stigma wherever we see it. But this is a collective effort, and it's important that we do not stigmatize during this time. Thank you.
Thanks very much, Aisha. A question for Dorrit now here, and this is a question actually that my own kids, my own teenage children have asked me a number of times over the past weeks. This is from Vasily Chernyshchev from the Russian Federation, and it reads, in the context of physical distancing, what about meeting at home with a small group of friends? Isn't that safe? Dorrit.
Yes, we are all faced with this question, and also ourselves. And I think here we need to differentiate between isolation and quarantine first. So isolation is for those who are sick, and quarantine is for those that are suspected or exposed and are not yet sick or included in that group, in that community. When we are quarantining because we want us to get away from exposure, we have to do the maximum we can to get away from that risk. And that is why we are distancing ourselves from those who might be around us, spreading the virus. We don't know them, and we said we do not want to stigmatize anyone. So for that, we are distancing ourselves and quarantining ourselves. It depends on the community and the amount, how many patients they have, how many confirmed patients and suspected cases, what is the epic curve there, and what is going on in the country. So it really depends on the local context. But normally we would say that healthy people can, few, 2, 3 can meet, keeping a distance, not touching each other, not sharing the same utensils, cleaning, just like as we saw Hans doing before, cleaning our hands and taking care of our own self-discipline in that regard. This could be okay in communities where it's not wide and wild transmission. We need to know who we meet, how we meet, and keep it as such. Many families and many people do not have this privilege. They cannot really keep apart from each other because they live in very small places or very small kind of setting. We need to understand that here the self-discipline of cleaning, not touching, staying away, and keeping the etiquette while coughing and sneezing, etc. We have to respect that while we respect all the rules and regulations of our communities. Back to you, Rob.
Thanks very much for those words. And the next question comes in from us from Manila, the Philippines, from Mary May Pagtumnan Asaron, as I say, from Manila. And it reads, can WHO advise on how to move forward? How can we prevent mental disorders like anxiety attacks or become obsessive compulsive? Some might be in that situation already, but they are not yet aware. Aisha, can I turn that one to you, please?
Thank you, Rob. So, because we know that mental health can worsen in a time of high stress, like that created by this emergency, we want to emphasize the basic strategies that everyone can take to promote and protect their mental health. So looking after your basic needs cannot be underestimated. We can feel mentally better if we are as physically well as possible. So eating healthily, making sure you have physical activity and ensuring you get enough sleep and rest. Social support, so physical distancing, as Dorrit said, does not mean to stay away from your social connections. There are many ways that we can stay in touch with each other now, and this is important more than ever at this time. We're all actually experts in our own well-being. So what people have done before in the past can help them now. So many activities which people find relaxing or which induce a sense of positive mood, whether it's a hobby or a psychosocial relaxation technique that you might have learned, keep doing these if these are helpful for you and if these are safe for you to do. When we're staying at home, routines, like I've mentioned earlier, are very important for creating a sense of structure. Minimizing the unhelpful coping strategies of using tobacco or alcohol can also be important for your well-being, and minimizing exposure to any content that you might find distressing in the news. So efforts can be made by everyone to keep emphasizing and communicating these simple strategies to each other, and these can make a big difference to keeping your mental health well. And as I've said before, ensuring the continuity of mental health and psychosocial support services is important. Mental health is a part of the public health response to COVID-19. This response needs to be coordinated in alignment with national authorities' guidance on COVID, and this might require a move to provide some services remotely, for example, through telecommunications. So people with existing mental health and substance use conditions should not have their care disrupted, and all people who might be more vulnerable to experiencing a deterioration in their mental health should have access. So there are actions that we can take ourselves and preparations that mental health services can take to prevent the worsening mental health in the population. Thank you.
Thanks very much, Aisha. One related question to this, which I'm also going to pitch to you now, is from Peter Holm here in Denmark. And it reads, what is WHO's concrete advice to doctors, nurses to tackle pressure and stress? Aisha.
Thank you, Rob. So glad this question's been asked. Health workers and all responders face immense pressure right now. And it cannot be understated that it's vital that we protect their stress. It's vital we protect their mental health. And as the regional director said, this is a marathon, not a sprint. So the protection of health workers' mental health is crucial. Along with the self-care strategies that I've just described, which health workers can take, there is a role for what the leads of health facilities can think about to protect the health, the mental health of health workers. And this can include an array of approaches, for example, rotating workers from high stress positions to lower stress positions, making sure that there's good communication in the team, and so that the team and other health workers feel able to approach their leads or their colleagues to discuss how they're feeling or how they're doing. Making sure that you've got experienced workers alongside less experienced workers can be very supportive, and this can be helpful as part of a buddy system. And really as much as possible, as though there is so much work that needs to be done this time, just initiating and making sure that there are breaks and that workers are getting sufficient rest will be very important. Ultimately, it's important right now to make sure that your health workers know how they can access mental health and psychosocial support if they need it. So make sure they know where they can go and who they can contact, and whether that requires having a mental health qualified or trained person available in the service for the health workers. And ultimately, we give this advice to managers of health facilities, but they themselves are also experiencing the same stresses as staff and maybe under undue pressure themselves. So it's important that all of this is taken into account for everyone that's responding to COVID at this time. Thank you.
Thanks, and sorry to keep you on the spot, but I've actually got another question for you that's totally related as well. We've just got time for a couple more questions, so before I bring the last one back to Hans and Dorrit, I've got just one more for you, Aisha, and it's from Jody Paulowski from France, and there's no organisation given or outlet given here. And the question reads, can you talk a bit about best practice for those giving birth in hospital at this time? This is a very stressful situation for many women that can increase the risk of mental health concerns.
Thanks, Rob. Yes, indeed, this is a very stressful time for many people in the population. Many different people have vulnerabilities to experiencing stress, and that's really conflated for some people, where there's also vulnerabilities and risks related to COVID-19 as well. This is a stressful time for expecting mothers, and I think I would encourage and make sure that there are plans in place to support the mental health and mental well-being of mothers who are due to give birth, having a plan in place to see what they might need and what can help them to feel as calm as possible, and ensuring that there is access to the necessary mental health or psychosocial support that they might need, whether that's available through the hospital or available through remote services, is going to be really important to protect maternal mental health. Thank you.
Great stuff. Thank you very much. And right, so I'm going to just take a final question here, and it's a general one, and it's for you, Hans, I think, in this case. This is from Sarah Newey at The Telegraph. It reads, is there any sense that the outbreak in Europe could have been avoided? Are there any measures that should have been introduced earlier to prevent such a large-scale outbreak? Hans.
Spot-on question, which I'm hearing a lot. This is something not to be avoided. We are living in a world, on a planet, full of viruses. We see it every 10 years. I think what Asia had in their advantage is that they underwent huge outbreaks in the past. The SARS, then there was the MERS in South Korea. So in that sense, I think society was a bit better prepared also for drastic measures, because the measure we put in place is always a balance between protecting the health of the population, the social and economic impact, and then the human rights of the people. So whether we were too fast or too slow is maybe we passed that bridge already. We know what has to be done, and we have to do it. We have to adapt to a new reality. And I think that is what we have to focus on right now. Myself, what did surprise me? Yes, I think I'm surprised by the speed. And I think many of us got caught by the speed, and we have to, without any shame, to admit this. So what we see after the economic crisis, when the banking system collapsed and previous crises, is when the crisis passed, we move on and we forget. I think that's the big lesson for all of us. This is not going to go away. If it goes away now, there will be for sure another one, and we had the Ebola as well. So health needs to be at the top of the political agenda, strengthen the health systems, the essential public health functions for the future, because health is a matter of health systems and Ministry of Health, but as well as the economy and the solidarity. And I think that's the key word, that we have to stand in solidarity, because the EU is heavily impacted now. Maybe other parts now we see more and more in the eastern part of the region. But if it diminishes in the EU, it becomes more in the eastern part, it will come back to the EU if we don't tackle it in solidarity. And I think that's really a key function that we have to keep in mind. It's a stress test for the psychological resilience which we discussed today, but as well as the solidarity.
That's an excellent note on which we should finish today. I'm going to thank you all for joining us. Please continue sending your questions in. Join us again, same time, same place, next week on this channel. But for now, that's goodbye from Copenhagen, and thanks very much for joining us and your attention. Thank you.